We presented some data from the Myeloma XI+ study here, and I think it's all really very exciting because at some level the UK is leading the world with these combination studies for people before they get transplants. And so we looked at a combination between carfilzomib, Revlimid, lenalidomide, cyclophosphamide and dexamethasone, so a 4-drug combination, and compared that to the standard 3-drug regimens that we used in the UK. And what we're able to show is that using this KCRD combination, you get more responses before the transplant, deeper responses after the transplant, and all for no extra toxicity. And I think this is really exciting because that's turned into a progression-free survival advantage, and I think will turn into an overall survival advantage. And what's interesting to me is that if you look after the transplant at what we call minimal residual disease with a test that will pick up one tumour cell in 10 to the 4 to 10 to the 5 normal cells, you show that almost 80% of people are MRD negative, so you can't find any disease. And so that's really interesting, that close to the transplant. So the hope is that in the future we'll get everybody to these MRD negative states and start to get more and more people into being long-term disease-free survivors who are off all kinds of treatment. And so I think this is a big step forward in the UK of pushing pushing the envelope around response, and we show clearly that the best responses get the best outcomes.